Right, Gerry. I'm really, really pleased to meet you. I'm really excited to hear what you're going to tell me about. Could you explain first who you are, something about what brought you into this kind of area of work, and then we'll look at what HHPA is doing?
Well, I am a recovering alcoholic and street homelessness. For 5 years I lived on the streets, I sofa surfed, I've slept rough, I've been in hostels. My addiction took me to so low that it was a struggle to come back out of it. I had very poor health, spent 3 months in a hospital. Then from that rehab...
And this was all precipitated by a crisis in your home life?
Yeah, I had a breakdown.
If people want to read about that, they can find that on the article.
I had a breakdown, physically, mentally, the whole lot. And alcohol was the only way that I felt that I could cope. So after very bad health, hospital, went into a rehab, then went into dry hostel. And I realised that being in a dry hostel, I needed to occupy myself. If I didn't occupy myself, I could see myself going back on the drink, because even though that was like 9 months into my recovery at dry hostel, it's still a very short time. So I first started I did a volunteer work for Ealing Council, Ealing supporting people, and I joined them. It was only once a month at that point, which I thought was okay, but then I took training from them and became a peer consultant, which was going around to hostels, interviewing the residents in the hostel to make sure that they were getting a correct service by the provider. I got asked by the commissioner in Hammersmith whether I'd like to do training for Groundswell. And to be quite honest, I didn't want to.
So Hammersmith and Ealing are kind of almost neighbouring.
They're next door, boroughs.
So people must have heard about you then. You must have been doing something right.
I must have done. I loved the whole concept of being with people who had been in my situation and trying to get some help for them. Because I was lucky. I got into the system and it worked for me. Well, it's a struggle.
They got you at the right time, when you're ready for...
Yeah, I knew I had to change, otherwise I'd be dead. And I would be dead today if I hadn't. It's as simple as that. But they said, did I want to do this training? And I thought, do I want to revisit all those things in my head that I'd put away in pockets and not want to bring them back? But I thought, I'd come along, give it a try. I can always leave. Started the training, thought I can always leave. But fell in love with the whole policy of Groundswell. The fact of going out and assisting and helping homeless people when nobody wants to help them because they feel that they're a burden, they're addicted, they're smelly, they're dirty. All these things actually are true, but they're people. And a lot of providers, a lot of GP surgeries, a lot of hospitals forget underneath all that addiction and the dirt, they're people. The same as what I was. I had the opportunity to be helped, and I hope by becoming a health advocate, I could help the people. Because people who are in the situation have lost everything, do not trust anybody. And one of the things about being a peer is that we've been down that road. You know, I mean, they can, and I can, you can pick out a homeless person and you can pick out a drinker a mile away. And peers, doesn't matter if we're in recovery now, we still have that look. We can still understand it. It's like a radar. Zoom, you know? And of course
that takes one to know one, as they say.
Precisely, and that's what the people in the hostels respect. That somebody has come out the other end and is willing to give them time. Because we don't judge. We can't judge because we've been there.